Picture this. You have an accident while playing a sport and break a bone that already happened to be a little fragile, but you obviously can't walk on it, so you don't want to leave the house until you can. You're desperate to hide it. You don't want anyone to know that you broke your leg, because how embarrassing would that be? You slipped and broke a bone. Mortifying? We're willing to bet that that the scenario that um, I explained probably never ever happened. Why would someone be embarrassed about breaking a bone? You can't help breaking a bone, right? Exactly. So why, when it comes to psychological disorders or mental illness, do we take the same approach? The only difference between having a psychological disorder and having a broken bone or the common cold or cancer is that the latter are physical. You can usually see the implications of a physical ailment. You might have a bald head indicating cancer, or like a nose, a red sniffly nose indicating that you have some sort of cold, or some cast indicating a fracture. But what if you got depression or bipolar or anxiety? What bandage can you wear to show you've got that and make it feel okay to talk about? Um, there's so many individuals in this country. 2/3 of people are suffering from mental health issues, and they feel so isolated, so worthless, so ashamed. And there's so many students on this campus that are diagnosed with varying psychological disorders. So it's a great time, or I wouldn't say a great time. This is the time to not make or not think of psychological disorders as being taboo. In this chapter, we're going to talk about anxiety, obsessive compulsive disorder, post traumatic stress syndrome, um, depressive disorders, bipolar, suicide, self injury, schizophrenia, dissociative personality, and eating disorders. Hopefully, you'll remember some of them. You might not remember them all, but definitely have a good insight on um, these psychological disorders. So, a psychological disorder is a condition characterized by abnormal thoughts, feelings, and behaviors. Psychopathology is the study of psychological disorders, including their symptoms and treatment, and they cause significant disturbance in someone's cognition. Definitely, emotions aren't regulated, and this is according to the APA 2013. Just maladaptive behaviors. This is always super interesting. The through the ages, psychologically disordered people have received some terrible, terrible treatment. They were considered mad, or sometimes caged, or given like therapies as like genital mutilations, beatings. They like pulled out teeth, and then gave blood transfusions from animals. I mean, they were treated pretty terribly. Think about like individuals that you know that may have a psychological disorder, and imagine them being treated that way simply because they were struggling and they had those maladaptive behaviors. Drilling holes like these may have been an attempt to release evil spirits and cure the mental disorders. Um, I'm sure some people probably survived the quote unquote cure, but they probably weren't actually cured. Okay. Now, in the 1800s, the medical model of mental illness treats mental disorders in the same way as a broken arm. There's thought to be some sort of physical cause. This model has been adopted by psychiatrists more so rather than psychologists. There was credibility gained from recent research in genetically influenced brain abnormalities in brain structure and biochemistry. What's happened is a growing number of clinical psychologists now work in medical hospitals where they work together with physicians to determine how the mind and how the body works together to to be able to treat some psychological disorders. With the biopsychological approach, general is basically biological, psychological, and sociocultural factors play significant roles in human functioning in the context of disease or illness. So epigenetics also forms an understanding of 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 the disorders. Okay, so an example would be research suggests that a family history of addictions make a person more likely to develop an addiction compared to people without a family history of addiction. Therefore, it is possible that a person's biological factors could play a role in the development of the addiction. Epigenetics supports the vulnerability stress model by showing how DNA and our environment just interacts with each other. So, I mean, I can definitely see how all of those factors can definitely play a role in a psychological disorder. So we have definitely seen this figure before, right? But basically, it's showing like how genes and childhood trauma, roles and expectations in the culture, it just the biological approach believes us to be a consequence of our genetics and physiology. It is the only approach in psychology that examines the thoughts, feelings, and behaviors from a biological, thus physical point of view. Therefore, all that is psychological is first physiological. So it's just one of those things. When it comes to the bio psychosocial approach to psychological disorders. So to understand how classification actually occurs for certain psychological disorders, there is something called the DSM-5. I think is it the 5? Yeah, or it's the 4. I think it's DSM-5 now. Geez, it's gone. We have a new edition now. But diagnostic classification systems have been constructed to help clinicians make diagnoses. The most commonly used classification system is the American Psychiatric Association Diagnostic and Statistical Manual of Mental Disorders, which is now at the 5th edition. What it does is it's called the DSM-5, and in the DSM-5, it predicts the disorder, it suggests appropriate treatment, and it also prompts research into its causes. So it's very helpful, especially when you are diagnosing. When you are diagnosing someone, you may be stumped. It just allows you to kind of do the research to make sure that that person is that you're, of course, suggesting the appropriate treatment, and that, of course, you're diagnosing them correctly. And like I said, DSM-5, which is the latest diagnostic manual, is still just a handbook used by healthcare professionals in the United States and a lot of the world as just an authoritative guide to diagnosing individuals with mental disorders. It contains descriptions, symptoms, and criteria for diagnosing mental disorders. Some of the things that they changed in the DSM-5 is autism spectrum disorders, so some label changes, new or altered diagnoses, and then new categories: hoarding disorder, binge eating disorder, which weren't considered mental disorders in the previous handbook. So here it definitely lists some of the criticisms. In a huge handbook with several mental disorders. It's not going to be perfect, but some things that I actually found, with my own research is that there is a unhealthy influence of the pharmaceutical industry on the revision process, and it's an increasing tendency to also um, medicalize patterns of behaviors and mood that are not considered to be like particularly extreme, but there are some benefits. It helps mental health professionals communicate, and it's definitely useful in research. Um, but even though there's some of the changes um, are controversial, it's it definitely gives you something to go by. It's going to be improved, I'm sure. The next one, I don't know. It's going to take many years for them to write a new one, but it definitely does aid in communication about mental disorders. No way does disorder equal danger. Um, just because someone suffers from mental health issues, they most people are typically nonviolent, and actually they're more likely to be a victim, more than they would be an attacker. So mental disorders seldom lead to violence. So here on this graph is showing you the psychological disorder rates, and here it tells you that it depends on the time, it depends on the place of the survey, but it does talk about poverty as being a risk factor. So typically, poverty in childhood is associated with lower school achievement, worse cognitive behavioral, higher rates of delinquency, depressive anxiety disorders, and higher rates of just almost every psychiatric disorder in adulthood. Now, mental health is never caused by just one thing, but poverty can be one factor that interacts with genetics, adverse life events, or substance abuse. But so far, the strongest evidence suggests that poverty can lead to mental illness, especially in cases of disorders like depression. And it even states here that individuals that may have schizophrenia, these disorders can actually drive people into poverty because it affects their day to day and jobs and thinking and things like that. And these are just some things that increase vulnerability to mental disorders. Um, Insomnia. Um, I actually had a friend who was diagnosed. Oh my God, it was was it ADHD or some sort of learning something, but it was all shown. It was all caused by the fact that she had insomnia. So she was falling asleep at the wheel and all this stuff, just like a whole bunch of things that the insomnia actually caused. Reading disabilities, substance abuse, those are risk factors. But some ways to protect against or to fight against it would be effective parenting, literacy, social and work skills, social support from family and friends. So I definitely give this list a look over. There are a few types of anxiety disorders, but and just anxiety disorder in general is marked by distressed, persistent anxiety or maladaptive behaviors that reduce anxiety. So breathing rapidly, feeling nervous all the time. And general anxiety disorder is the person is continually tense um, and and apprehensive. They have trouble concentrating or thinking about anything other than the present worry. Some other types of anxiety disorders is the panic disorder. And that is basically when people worry that they will faint, embarrass themselves, have a heart attack, go crazy, die. And panic disorder, the panic attacks are unexpected, typically, and unpredictable. Okay. Phobias are an extreme or irrational fear or aversion to something. Excuse me, sorry, I don't have COVID, at least I don't think. These are just some of the common and uncommon specific fears. Being alone, um, heights, flying, um, blood, and you can look at the difference. The fear is in blue, and then phobia would be in green. So um, that is just the that extreme or irrational fear. Somebody may have a phobia about being underwater or something like that. May not ever happen, but they fear it anyways. My husband actually got over or a fear. It wasn't really a phobia. He would probably describe it as a phobia. But we were in the ocean when we were in St. Thomas. We had like a turtle excursion, so we swam with the turtles and stuff. But he can swim really well, but he was so nervous because he kept like obsessing about a shark being out there. And even though like everyone's like, no, there's not many sharks out in this, on this side, but he was still so fearful that he actually cut his excursion off a little bit shorter, a little early, excuse me. It's also known as obsessive compulsive disorder. Most people with OCD have both obsessions and compulsions. Some common obsessive thoughts would be um, order, symmetry, things like that. I actually had a student that I worked with who had a learning disorder as well as OCD, and it was very difficult at times to work with the student because they liked everything to be in order and symmetrical. He would want all his pencils to be perfectly sharpened. If it even became dull, um, he would start experiencing anxiety so that he could, go sharpen it so that he'll get the symmetry back again. I also noticed that he also wanted, like not only that, what else? I can't remember, but oh, he if he erased something and it became too messy on the paper became too messy, he would want another sheet so he could do his assignment over, write it better, things like that. Um, Fear of being contaminated by germs or dirt or contaminating others, excessive focus on religious or moral ideas, and fear of losing or not having things that you might need. Some common compulsions that may happen with an individual with OCD is ordering or arranging things just because, accumulating junk, so hoarding, repeatedly checking in on loved ones to make sure they're safe, counting, tapping, repeating certain words, or doing other senseless things just over and over to reduce anxiety. Um, OCD is actually more common among teens and young adults than it is among older people. I talked about the compulsions and, the obsessive thoughts and things like that. Uh, but these are some of the percentages that kind of um, support those individuals with the certain symptoms. So post-traumatic stress disorder, also known as PTSD, you'll often see that it's associated with individuals in the military, which in fact, um, you know, post-traumatic stress disorder can develop after a single very stressful, frightening, or distressing event or after a prolonged traumatic experience. It's characterized by
haunting memories, nightmares, jumping anxiety, numbness, and or insomnia that could linger for 4 weeks or more after a traumatic experience. Often affects battle scar vets, like I said, and survivors of varying accidents, disasters, sexual assaults, things like that.
So, um, obsessive compulsive disorder or OCD is a mental illness that causes that repeated, unwanted obsessions. It gives you an urge to do something over and over again, so it causes compulsions. Some people can have both obsessions and compulsions. OCD isn't about a habit like biting your nails or um, thinking negative thoughts. Um, there are people who want things, they like constantly check. I had a cousin who would go back and check her doors to make sure they were locked, go back again, check, and have to turn the doorknob, turn the doorknob like a certain amount of times to make sure it was locked. Um, making sure some people like want to make sure things are perfectly in line. I used to have a student who suffered from OCD, and he had to he would use a pencil that you would sharpen, but it would have to be perfectly sharp. It couldn't um, like the lead would have to have that point on it. If it didn't have the point, um, if you didn't allow him to go and sharpen that pencil, he would have like an anxiety attack. Um, he would also keep his pencils lined up so neatly on his desk. Even hoarding is considered OCD, just the fact that people are holding on to things. And, you know, OCD is a chronic condition. Sometimes it can fix itself, but it's generally not cured completely. So it doesn't really go away without some sort of treatment. Um, Stimulus generalization is basically when a fearful event can later become a fear of similar events. So it's like generalizing something. So um, the tendency of a new stimulus to evoke responses. So, for example, Ivan Pavlov conditioned dogs to salivate during the sound of a bell and of food, right? So, but it could also cause an issue with fear. Um, and so, for example, if you're scared of like like cats, something really funny about that. I had a cat that I was so excited. It's such a beautiful cat. I wanted to pet it. Went to pet it, it snapped on me. And so from that point, I basically generalized that I'm scared of cats and they're going to bite me, even though they probably won't every time. But a reinforcement can help maintain and develop a generalized phobia. So the second time my husband's cat, not husband, Lord Jesus, he would kill me. My ex boyfriend's cat tried to bite me. That was the second cat. It kind of maintained that fear. So I'm not really that um, accepting of like cats being super close to me. Um, but it's just because I've generalized that to all cats, even though there's some really sweet cats out there, I'm sure. So, Olson and his colleagues basically saw that by observing others, it can contribute to development of some fears. My stepson actually, his mom is like fearful of, I guess, everything flying because when he comes over, he's like scared of like mosquito, like any. Not well. I mean, pretty much we can't really see the mosquitoes, but like if there's a bee or a wasp or a fly, anything that he can physically see flying in the air that's an insect, he's like completely scared of it. So I knew when Genesis came, I was gonna, even if it was a bee or a wasp, I was literally gonna just like act like it was nothing, even though I don't. Bees aren't don't scare me so much, but the wasps do. Because they are very, if you get bit, it really does hurt. However, I don't want him to go fanning at those bugs and get bit, so, or panic or anything like that. So I tried to make sure that that he doesn't observe me being fearful of many things, even if I am, so that he won't be. I do want him to be smart, but not running from a fly, right? But Olson and colleagues found that wild monkeys tend to be afraid of snakes, but those um, who were raised, uh, where were they raised? In the laboratory. Sorry, they typically weren't afraid of um, of snakes. And when it comes to our past experiences, our interpretations and our reactions, sometimes it can just make us super hyper vigilant of like things happening around us. It shapes our reactions. So when it comes to the biology, our genes, of course, definitely play a great role in our predisposition to anxiety, OCD, and PTSD. Um, so it's a figure. I think it's on the next slide, but it shows that people engaged in challenging cognitive tasks with OCD show the most activity in their anterior cingulate cortex in the brain's frontal area. So there are some things that definitely show, as far as like the pathways and when they're doing these brain scans to detect psychological disorders. Now, natural selection basically is saying that like our ancestors may have faced dangers um, and basically it exaggerates why our species may respond to something in the way that we respond to them. So it says gone wild, it's become it becomes compulsive hair pulling. So too with washing up with becomes ritual hand washing. So although natural selection shaped our behaviors, when taken to an extreme, these behaviors can interfere with our daily life.
With OCD, with any mental illness or personality change or maybe the loss of speech, whatever the case may be, those things are can be attributed to certain parts of our brain. Um, Hyperactivity of the anterior cingulate cortex in patients with OCD has been shown to increase with symptom provocation and to normalize with treatment induced symptom reduction. So you can see where there is activity in that part of the area, and that's in the brain's frontal lobe. Depressive disorders, well, for depressive disorders, they listed major depressive disorder and persistent depressive disorders. Everyone struggles with down days, but you may often wrestle with like hopelessness, lack of energy, but depending on how long you felt that way, you may have major depressive disorder or persistent depressive disorder. Major depressive disorder um, and persistent depressive disorder overlap in some ways, but there are key differences. Um, PDD, which you may hear people call it dysthymia, um, involves fewer symptoms, but they last longer, at least 2 years. You can be diagnosed with major depressive disorder if you have symptoms for 2 weeks. Both are very serious. Both are very serious. Sometimes to figure out if you have um, PDD, you may experience like loss of appetite, problem sleeping, low energy, um, low self-esteem, difficulty concentrating or making decisions. Um, if you have PDD, you'll have at least two of these symptoms along with a depressed mood. The symptoms will have hung on for at least 2 years without much relief. If you have MDD, you'll have more symptoms, at least 5. They'll last, um, for about 2 weeks, and they may be worse. So, depressed mood, loss of interest and pleasure, noticeable weight gain, thoughts of guilt or worthlessness, suicidal ideation, things like that. Bipolar disorder is a mental illness. It's typically marked by extreme shifts in mood. Symptoms can include an extremely elevated mood. They can also include episodes of depression. Um, Bipolar is also uh, known as bipolar disease or manic depression, but for the most part, you'll hear most people call it bipolar disorder. Um, Mania, uh, you'll hear that term, but typically the word manic or mania describes the time when someone with bipolar disorder feels overly excited and confident. These feelings can involve irritability and impulsive or reckless decision making, buying like super expensive things without the money. Bipolar disorder is much less common than major depressive disorder, but it's often definitely more dysfunctional. Um, and with bipolar disorder, you'll see more of those individuals committing suicide, or is a larger or a bigger predictor of suicide. So there's, many ways for us to understand major depressive disorder or depressive disorders and also bipolar disorder. Um, Behavior and cognitive changes accompany depression. So people um, like with people like that feel trapped. They feel alone. They feel like there's no brighter side of things. Depression is also widespread. It is not atypical to have depression. Over 350 million people have depressive disorder, and over 60 have bipolar disorder. And it also mentions that numbers show that um, women risk women's risk of major depression is nearly double for men. Now, I don't know if this is a cultural thing for Western men, not actually reporting accurately, but I mean, women tended, when they were surveyed about being happy, about being diagnosed with depression, it often doubled that of their male counterparts. Um, and most major depressive episodes tend to self terminate. um, there's therapy, there's meds, um, for people to be able just to fully recover and return back to normal. And then it also talks about like stressful events related to work, marriage, and things like that. About 1 person in 4 diagnosed with depression have been brought down from a significant trauma, such as a loved one's death, physical assault, a lost job, things like that. And then with each new generation, depression is striking earlier in life and um, affecting more people. In North America, young adults are 3 times more likely than their grandparents to report having recently or ever suffered depression, despite their grandparents' many more years of being at risk. So the increase may reflect the cultural difference of today's young adults, greater their greater willingness to disclose, you know, that they actually have depression. So genetics, and this is just showing, they did a twin study. Um, Typically if your twin had some sort of like bipolar schizophrenia, typically the other twin would have it as well, versus identical would typically have it, versus fraternal twins. But genes definitely do work together in producing or in increasing the risk for depression. The lowest thing on the list was generalized anxiety disorder. However, I mean, it still shows that, it's a little less than 30%. So we have learned throughout this entire book that genes play a huge role in how we turn out. So when it comes to depression and the brain, in the brain activity, it actually slows down during depression. That left frontal lobe is less active. Um, and the neurotransmitter systems influence depressive and bipolar disorder. Um, see, and also diets associated with inflammation and excessive alcohol use are correlated with depression risk. The next slide, you'll see how the PET scan shows the depressed state. Then you'll see how, um, it looks when you're going through mania, when you're in the manic state as well. But it says the PET scans show the brain's energy consumption, the rises and falls with the patient's emotional switches. The red areas show where the brain is using energy most rapidly, and you'll see it in the next slide. Many people have kind of learned that diet plays a great role in, um, our bodies and uh, our not only our bodies but our brains. But people who eat Mediterranean um, like diet type foods, heavy on the olive oil and the veggies and the fish, typically don't have issues with depression. But excessive use of alcohol is definitely correlated with depression and being at risk for depression. I met someone like this but didn't really know or have concrete evidence that this person suffered from some sort of depressive or bipolar disorder. But um, depressed people typically view themselves negatively. They view the world negatively. They learn helpless. They begin to be helpless. Learned helplessness may coexist with self-defeating beliefs. They blame. They're pessimistic. It's just they can't really see the good in anything. The social cognitive perspective explores how people's assumptions and expectations influence what they perceive. Um, Many depressed people just totally view, um, things through like dark glasses. The glass is like half empty. um, it's not funny, but I don't know. I'm laughing, but forgive me. It's late. I'm working on this. But anyways, the social cognitive perspective, it explores how people's assumptions and expectations influence their reality, essentially. Self-defeating beliefs and negative explanatory style contribute to, um, you know, the cycle of depression. And the social cognitive perspective also views depression as an ongoing cycle of stressful experiences, which lead to negative moods and actions. Um, so, expecting the worst, depressed people magnify bad experiences and minimize the good ones. And in the text it says their self-defeating beliefs and their negative explanatory style feed into their depression. I used to have a staff member. They recently graduated, and no matter how much you complimented them and truthful compliments. I mean, I believe in being honest, but they will always find a way to turn it into something negative. Now, I didn't have a official diagnosis from them or anything like that. They seem to function decently. But there's people who like will turn everything. It's all about feeding into um, the negativity. Explains how people who, um, may be depressed and those who, um, who are like able to cope and function and deal with like traumatic and varying situations that may not be in their favor. But you break up with a romantic partner, um, they may be like, well, I'm never going to get over this. I can't do anything. Then you start blaming yourself and then the depression, right? Someone else that's able to cope and deal, function, they may say, this is hard to take, but I'll get through this. I miss my partner, but thankfully I have friends and family. Um, then it takes two to make the relationship work, so they don't just blame themselves, and then they're just able to successfully um, cope with things. So it you can go down a path of depression, but if you're able to successfully cope, you still feel, but you're able to, um, figure out, okay, I'm gonna go through this, but there is a brighter side to all of this happening. Therapists recognize this cycle. They work to help um, depressed people break out of it by changing their negative thinking, turn their attention outward, engage them in more positive, pleasant, and also competent behavior. Individuals that suffer from depression typically are at higher risk of um, committing suicide. A suicide affects about 1 million people worldwide, and 1 in 25 of those attempts to commit suicide are successful. A lot of times, you'll hear about someone cutting or burning themselves, and those are considered non-suicidal self-injuries. And oftentimes, individuals will do this to gain some sort of relief from the intensive negative thoughts, kind of distract them from what's already going on with them. So, research into suicide rates when it comes to different groups shows national differences. And in the text, it talks about Britain, Italy, and Spain. Suicide rates have been little more than half those of Canada, Australia, and the United States. Within Europe, people in the most suicide prone country have been 16 times more likely to kill themselves than those in the least. So it just kind of depends on where you are, even within the same country. Racial differences. Whites and Native Americans kill themselves twice often as Black, Hispanics, and Asians. Um, Women are much more likely than men to attempt suicide, but men are 2 to 4 times more likely to actually end their lives. Men typically will use more lethal methods, firing a bullet, which is the method of choice typically. Age differences. Um, in late adulthood, the rates increase with the highest rate among 45 to 64-year-olds, and the second highest among 85 and older. Um, so, in the last half of the 20th century, the global rate of annual suicides um, have nearly doubled. I didn't know that. Actually, yeah, I didn't know that. and that's according to information from 2008. So um, I don't know what it's looking like now. But when it comes to other group differences, uh, suicide rates have been much higher among the rich, uh, widowed, divorced, and then people tend to kill themselves or commit suicide during the middle of the week. 25% of U.S. suicides occur on Wednesdays. Suicide rates are highest in April and May, and not over the winter holidays, which is actually commonly believed. Schizophrenia is a mental disorder um, that basically is characterized by faulty perceptions, inappropriate actions, feelings, withdrawal from reality, um, kind of like a mental fragmentation. Um, some of the symptoms are disturbed perceptions, disorganized thinking and speech, and also diminished and inappropriate emotions and actions. Chronic schizophrenia is basically when someone experiences delusions, hallucinations, incoherent speech, and this usually appears by late adolescence or early adulthood. Typically, when people are heading into college, a lot of times you'll see people get diagnosed with schizophrenia. At least in my experience of like just watching college students around me, and as people age, psychotic episodes last longer and recovery periods are shortened. Um, those with acute schizophrenia is basically the active phase of schizophrenia. It could begin at any age. It's typically the result of something traumatic happening, and it typically has extended recovery periods. Schizophrenia um, has a lot of brain. People with schizophrenia tend to have brain abnormalities, excessive number of dopamine receptors. Bottom line is schizophrenia involves not one isolated brain abnormality, but problems with several brain regions and their interconnections. So, low activity in the frontal lobe, more rapid brain tissue loss, things like that. So, when it comes to prenatal and environmental risk, typically uh, low birth low birth weight can open you up to um, schizophrenia, um, your maternal prenatal nutrition, having some sort of virus or sickness during your pregnancy. Those all will increase your risk of getting schizophrenia later in life. Genetic factors. The odds of being diagnosed with schizophrenia are nearly 1 in 100, but 1 in 10 for those individuals with that, but 1 in 10 for those individuals with a diagnosed family member. Adopted children's risk related to a biological parent, emergence of a disease influenced by many disease and the epigenetic factors. So, like, we can do this with everything that we covered: genetics. You know, the odds of you getting schizophrenia or any other psychological disorder is going to increase as those in your family may have had those psychological disorders. Dissociative disorder is a mental disorder that involves experiencing a disconnection um, and lack of continuity between thoughts, memories, surroundings, actions, and identity. People with dissociative tend to escape reality in ways that are involuntary and unhealthy and cause problems with them being able to function. Now, the disassociative um, the dissociative identity disorder is a little bit different. Um, Typically, it happens. It's very rare, but memory loss, a sense of being detached from oneself. It used to actually be called um, multiple personality disorder, um, but people tend to alternate personalities with this disorder as well. Personality disorders is a type of mental disorder in which you have a rigid and unhealthy pattern of thinking, functioning, and behaving. A person with a personality disorder has trouble perceiving and relating to situations and people. It lists the three clusters that it's characterized by: anxiety, eccentric or odd behaviors, dramatic or impulsive behaviors classify personality. Antisocial behavior or personality disorder um, is a mental disorder in which a person consistently shows no regard for right or wrong and ignores the rights and feelings of others. Typically, people with antisocial personality disorder tend to antagonize, manipulate, or treat others mean or harsh. Um, they show no guilt or remorse for this behavior. Researchers have found reduced activation in a murderer's frontal lobe. Um, this brain area helps put the brakes on impulsive, aggressive behavior. Can't talk psychological disorders without talking about eating disorders. Anorexia nervosa is a person, typically an adolescent female, maintaining a starvation diet despite being significantly underweight. Bulimia nervosa, the person alternates between binge eating, then they may purge or use some sort of vomiting. They may vomit or use some sort of laxative, um, excessive exercise to try to get rid of it. And then binge eating disorder is basically just a significant binge eating followed by just disgust and like ugh without the purging, without the fasting, without the excessive exercise. So just a takeaway: people with anorexia nervosa continue to diet because they don't see themselves as being below weight like they really are. They see themselves as being fat. People with bulimia nervosa secretly binge and then compensate by purging. People with binge eating disorder um, do not follow the episodes of purging. So I think there's so many things that could bring an eating disorder on: cultural pressures, low self-esteem, um, negative emotions that interact with stressful life experiences. So even like certain sports and maybe if you're a ballerina or something, you may pretty much starve yourself so that way you can fit into your costume, whatever the case may be. There are so many different um, experiences that could cause you to make that decision or turn to eating disorders. So this is the last slide for this chapter. This is the last chapter. Um, so we will be taking our final on Monday from 8 to 10. I think that's our slot. Not this Monday, but next Monday. So I will list all of that information on D2L. for, so you guys will be prepared. But it's just during the normal exam hour and an exam day. I was going to try to do it differently, but we have to follow um, follow the times and the dates for finals so that doesn't interrupt any other final that you have to take.